along. I've been joined by Jerome Weimar, the COVID response commander, to provide the coronavirus COVID-19 update for today. So yesterday there were 511 new cases of COVID-19. All except one were locally acquired. 124 cases were linked, and we now have 4,697 active cases of COVID in our state. Sadly, we had been notified of the death of a woman in her 50s, and I take this opportunity to pass on all of our deep condolences and thoughts for that person's family and friends at this very sad time. We have 208 people currently in hospital with COVID-19, 49 are in intensive care, and some 32 are on a ventilator. Of the cases, cases in hospital yesterday, some 87% were not vaccinated, 12% were partially vaccinated, and 2 were fully vaccinated. In regards to tests, very solid day yesterday. Some 55,476 tests were processed. I can say that 2,079 of those were in Ballarat. A week ago, on the same day, just some 300 tests were processed in Ballarat. So the people of Ballarat have come out in great numbers to get tested. There were 43,993 vaccines delivered at our state-run hubs yesterday, another daily record for our vaccination clinics. We've now administered more than 3 million vaccines through the state-run clinics. That's a substantial figure. That's approximately about 50% of the figures overall. I do note with great enthusiasm that the GPs and other clinics are now really starting to ramp up as well. You'll recall that the states were originally signed up to the Commonwealth's plan to deliver around a quarter of the vaccines. If we can do more, we're only too pleased to do so, because vaccines is the way through this pandemic. That record figure for yesterday has pushed us over the 70% figure for first vaccines, for first doses, allowing us now to take those few cautious, modest steps to easing restrictions that will kick in at midnight tonight. Pleasingly, another very solid day of people making bookings through the state-run clinics. Some 80,500 people made bookings for vaccines yesterday. And we have right now some 7,700 AstraZeneca and some 5,600 Pfizer appointments available in the system. So please get online, and if you've yet to be vaccinated, do that today. In regards to the outbreak, Jerome will go into more details, but a particular focus of concern has been the steady growth in cases in both the eastern and southeastern suburbs, with 38 new cases today and some 329 active cases across that wider region. We want to make sure that everyone in those areas gets tested at the first signs of symptoms. And can I use this as an opportunity to just please call on Victorians wherever you are, but at the moment, particularly in the east and the southeast, if you show even the slightest symptoms, please come forward and get tested. It is the most important thing you can do. Don't wait, don't hesitate, come forward and get tested. Get you the result very quickly. If you need financial support to wait for that test, if you need financial support for longer support, we're there. Please come forward and get tested. It is critical. But we also want to make sure that we stay ahead of the outbreak through vaccinations. That's why we're targeting the 100 Postcodes of Concern program for additional vaccine opportunities and pop-ups and particularly in the east and the southeast. So today we are launching a new clinic at Dandenong's Palm Plaza in Dandenong, and a pop-up site at the Hallam Mosque. We're also opening a new site at Eastland Shopping Centre, which will start off at 300 doses a day and then very quickly graduate to 1,200 a day in a couple of days' time. I'll hand over to Jerome to take us through the geography of the outbreak, but can I just foreshadow that with the work being done for the roadmap for Sunday and managing the outbreak, both Jerome and I are due elsewhere in the not-too-distant future, but we're always here to take the questions. So, Jerome.
Thanks, Minister, and good morning. 511 cases in Victoria in the last 24 hours. That's 4,697 active cases of coronavirus in the state at this point in time. Remains a very similar pattern as recent days. 85% of all of our cases are under the age of 50, and a quarter of all of our cases are in their 20s. This continues to be an outbreak of young and active people. 95% of today's cases are in the northern and western suburbs. 276 of those cases are in the north, including suburbs such as Craigieburn, Roxburgh Park and Broadmeadows, again names familiar to us over the last few weeks. We have 185 new cases in the western suburbs, in Truganina and in Hoppers Crossing and other suburbs in those areas. And as the Minister mentioned, we have 38 cases in our southern and eastern suburbs, including in Cranbourne North and in Pakenham and Dandenong. And there's a significant response, of course, underway with local partners in those areas. We also have 9 new cases across regional Victoria, and I'll talk about those a bit more in a moment. And there are 3 further cases that we continue to investigate. They dropped late last night. In terms of the overall picture, again, 91% of our cases continue to be in the northern and western suburbs. 95% of today's cases are in the northern and western suburbs. That's the real focus of our ongoing activity. In terms of the 9 new regional cases, we have 3 further cases in Ballarat following a really strong day of testing yesterday. And can I just thank everybody who came out and got tested in Ballarat yesterday and again this morning. The 3 positive cases we have now means we have 9 active cases in total in Ballarat across 3 different households. All the 3 active cases today are known household primary close contacts. So that is a somewhat encouraging sign. Of course, we never like to see positive cases, but we don't have any mystery cases today in Ballarat following a really strong day of testing. We have 187 identified primary close contacts. Of those 9 active cases, 2/3 of them have already returned a negative test result, and I expect the remaining of those results to come through in the next day or so. We do, however, have around 30 exposure sites across Ballarat, so I would ask, please, the community in Ballarat to continue to come forward and get tested. Please check those exposure sites. Some of those active cases have been particularly dynamic over the last couple of weeks during their infectious period. We have 8 testing sites now up and running across Ballarat, including a site at the Federation University at Mount Helen that will open up in an hour or 2. Again, my thanks to the entire local team that's down there, particularly the City of Greater Ballarat and Ballarat Health for their fantastic efforts over the last 48 hours. We continue to expect a busy few days ahead as we work our way through testing anybody who's got symptoms and anybody who's been to those exposure sites and anyone who's got concern about their potential exposure. We also have 2 new cases in Geelong. One of those is an employee at a call centre in Melbourne, so we're working through some contact tracing there. And the other, their source case is we're still inquiring and working out exactly where they've obtained the infection from. Their partner works in Melbourne. Obviously, testing results are due back for their partner shortly. We'll continue to watch those 2 cases very, very carefully. Both cases have had minimal movements in the community, so that's a somewhat positive step. We've also had 2 further cases reported in the Melbourne numbers earlier, who both live in Melbourne but travel to Geelong to work at an office building there. We believe transmission occurred at that office building. Again, and can I use that, yet another example again of really a call out to employers. We've had, there are very clear guidelines around what constitutes essential work. There are, of course, some essential jobs that are undertaken in offices that do need to continue in situ. But please, I'm asking all employers to consider very carefully before you ask your staff or require your staff to come to work. It is only if their work is genuinely essential, not it's just a little bit convenient. It's, again, a highlight of an example of 2 staff coming out of Melbourne, which is locked down, going into regional Geelong to work at their employer. It's something I would rather see less of if we could. We also have a case in rural Western Victoria in the East Wimmera. This individual has been isolating very closely. They live in a fairly remote location. We have a pretty good line of inquiry around their possible source acquisition. We need to land that over the coming day or so. We also have 2 new cases in Mitchellshire. One of those is a construction worker in Melbourne, and the other is a result that came in late last night, and we're investigating that this morning. I should add that now makes us 11 active cases in Mitchellshire, all acquisition well understood, all isolating, and 13 active cases in Geelong at this point in time. So we are watching those 2 locations very closely to make sure we don't see any further seeding out in those 2 critical regional areas. Finally, we have one further case in the regional results today from the Latrobe Valley. It's an individual who works at 2 fast food restaurants in Traralgon. Acquisition is underway. Again, we have a pretty good line of inquiry back into Melbourne, but we'll confirm the details of that during the course of the next 24 hours. We have 36 primary close contacts in the area. 92% of those have already returned a negative test result. And again, my thanks to all of them for coming forward so quickly for getting tested. And of course, we'll watch that case very closely. In terms of, obviously, with the closure or the lockdown in Albury, all Albury residents are now subject to those New South Wales restrictions. We continue to operate our Victorian border bubble between border communities. And of course, for those people who are in Wodonga especially, there are already restrictions underway in terms of what you're entitled to travel into New South Wales border bubble for, including Albury. I'd of course please stress again to Wodonga residents, only enter Albury if you absolutely must for an essential purpose, and we would of course much rather you minimised any movement in the Albury area at this point in time, recognising of course there are essential workers in our healthcare system and other key activities that will need to continue, and we'll need to be mindful of their exposures as they do so. We also have now 4 examples in the last few days of truck drivers who have travelled through the Wodonga area in the northeast who have subsequently turned out to be positive, either in interstate testing results or Victorian testing results. We of course continue to provide a lot of support to the freight industry, critical interstate freight, both in terms of additional testing stations. I think there's 5 or 6 dedicated testing stations for the freight industry and additional vaccination opportunities for the freight industry. Critically important that this most critical of all services maintains very, very strict protocols around their activities and gets vaccinated very, very quickly indeed. And finally, in terms of the planned protests that are due tomorrow, and of course Victoria Police are leading the operation and the management of those issues, I can confirm we have 2,700 vaccinations booked in at Jeff Shed and at the Royal Exhibition Building for Saturday. People who are coming in for those vaccinations will be able to cross police checkpoints with evidence of their appointment. So please, either your online evidence or you can print it off at home and use that. We are not, of course, taking any more bookings for vaccinations at Jeff Shed or the RAB for that particular day. So it is only those who are currently booked in. If you do not intend to attend for that vaccination appointment, that's absolutely fine. There are alternative appointments available on other days. We'd of course appreciate it if you could go online or give us a call and make those changes now, so we don't have staff standing around waiting for you to come forward. Finally, again, my thanks to everybody for the huge work that's going on. Significant and strong testing numbers, a lot of activity on the ground across all of our regions, particularly in the Metro Melbourne area. And my thanks to our very many local and state partners for the work they're doing to do all we can to minimise community transmission and particularly to control those regional cases I've gone through. With that, I'll hand back to the Minister.
Jerome, before you go, can I just ask a quick question? Do we know which LGA woman in her 50s that passed away from COVID was from?
I'll confirm that in the Cho release. I won't give it out here now. That's okay, Mitch.
While you're there, just on those that have vaccine appointments.
I'll stay here for a bit now.
Oh, thank you. Those that have vaccine appointments at Jeff Shed or the museum, Can they come in on are there any buses being organised for them to
No.
get in? There was some talk of that earlier in the week.
No, look, I think given there's a fair amount of logistical management, obviously for Vic Police and for our transport partners tomorrow in any way, we're not going to start arranging additional transport shuttles for people. There are, of course, alternative appointments available, not only at those 2 locations on other days, but also at any of our other 55 vaccination clinics across the state. So I would say to people who are booked in for those vaccinations, if you live locally and it's the nearest centre for you and you can easily walk there, then please carry on and do that. If you would rather not come in for your vaccination appointment, that's fine. Make an appointment for another day, the Sunday, the Monday next week. There are vaccine appointments available.
Have
And
we
the
seen
proof,
cancellations
sorry,
of other...
on that, the proof is that Department of Health email that comes.
Yeah, that's right. It's the online email booking. You get the confirmation text message. Just use that and bring your own ID along, and I'm sure the police will be very sensible about it.
Have we seen cancellations at other vaccination hubs around the city due to these protests at all?
No, not at all. No,
Any other
we've seen neither we've seen no significant cancellation of bookings. We've seen no significant additional bookings either. So this is a very normal day for us.
The East Wimmera case, you said you've got a line of inquiry.
Yeah.
Is it linked to Ballarat or Melbourne or something else?
Yeah, there's a link with some activity that was undertaken on site. We believe there were some workers probably from the Ballarat area that came in, but we'll follow that through over the next day or so.
When Pfizer's supply ramps up, in the coming weeks,
Yeah.
is there enough capacity, enough staff to actually cut the Pfizer dose gap from
Yep.
6 weeks to 3 weeks?
So look, at the moment, across the GPs and the state clinics, we're running around about 500,000 doses every single week. That's been the pattern for the last couple of weeks. I expect we'll beat that this week. As the Minister said, the GPs are starting to ramp up their activity. We're also due, of course, to get pharmacists coming in on board with Moderna in the coming weeks. That's a really important and exciting step. Gives yet more access points to people. So we'll continue to rise our numbers. I'm expecting to hit in the state system around 270,000, 280,000 the next week or so. And we'll keep pushing those numbers up in terms of as the supply becomes available. Look, we're not yet there in terms of we've still got significant. 30% of Victorians have not yet had their first dose. We are really determined to get those first dose appointments done. As the Chief Health Officer advises, that's what gives you the most significant step up in your protection from the virus. So we're not intending at this point to reduce that interval period. Supplies are still somewhat constrained, and I want to make sure we get as many people through their first doses as fast as we can.
Jerome, the Premier mentioned yesterday some projections on when we'll hit those double dose targets.
Yeah.
I think he said about the 26th of October
That's
for
right.
70%.
Yeah.
Is there a slowdown in any cohorts in getting that second dose? Are we seeing in any ages in particular people not coming to get it? And if so, why would that be?
No, not yet. Actually, I mean the projection lines and the sort of acceleration lines are pretty consistent for all age groups. So if you look at the over 70s, 89% of them have already had their first dose, and those numbers they're not huge step ups every day, but we continue to see people over the age of 70 coming forward to get their first dose. I think I've got my notes here. In terms of the over 70s, 76% have had their second dose already. So the follow through on second doses is really good. For those in their 50s and 60s, well over 80% of them have had their first dose already, and they're continuing to come forward, and those numbers continue to rise to 85, 86% every single day. So we're not seeing any of, we haven't hit any glass ceilings yet by age group that says that people are slowing down their willingness to get vaccinated. I'm sure it'll happen at some point, but I think right now all the evidence is Victorians want to get vaccinated as quickly as they can, and they're using the state system and they're using the GP system. And
In general, is there a percentage of how many people are getting that double dose? Is it like 99, 100%, or is the ceiling kind of 99?
well over 98, 99% of people are getting their second dose in that time window when they're due. So recognising that for those on AZ, that time period originally was a bit longer. So we're seeing that lag. And we'll see that 6 week lag now for the Pfizer doses too. But those lines are all starting to increase quite solidly. Over half of people over the age of 40 have had their second dose already, so they're fully vaccinated. For those in their 50, the age between 50 and 70, 6 out of 10 of them have had their second dose. So we are seeing really strong uptake of second doses and first doses.
Some people who've had COVID are being advised to wait 6 months before getting vaccinated. There's information on the federal, I didn't believe it either, but there's information on the Federal Health Department website to that
Right.
effect. They want to get vaccinated and they want to be able to show that they've been vaccinated so they can do things like go to picnics. What should people in that position do?
Yeah, I'm not a clinician, Rachel, as you know, but that surprises me. That's a strange bit of advice. My advice to anybody who's in that predicament is please go and see your GP as soon as you can and say, look, I'd like to get vaccinated. When is the right and safe time for me to go and get vaccinated?
What if their GP tells them to wait 6 months? I've had someone contact me in that position.
Right, I'd go and find another GP if it was me.
The Federal Health Department website
Yeah.
has information to this effect too. So there will be, 25,000 or however many people in Victoria who've had COVID will be in this position.
So, Rachel, obviously I can't comment on the Federal Health Department's website and what they put on there. Very happy to take that question on notice and see what other advice we'd have. But certainly, I think in the 7 months, 8 months we've been running the vaccination program, that's not a stumbling block we've hit so far. And yeah, my encouragement to anybody who's out there who's had COVID, and there aren't that many people in Victoria who've had COVID, but for that small minority who have, please go and talk to your GP and get the best advice for you. And I'm sure I'll get the Cho to brief you on that later.
Jerome, there's a group of health officials, the AMA, the Nursing Federation and the like, who are very anxious about opening up too quickly.
Yeah.
Should we wait until we're 80% double dosed before really lifting restrictions?
Yeah, not a question for me. The Minister might want to comment on that, but not a question for me.
Can I ask Jerome quickly, you mentioned a construction worker in Mitchellshire who works in Melbourne. Is that a new outbreak at a construction site or linked to a previous one? And how many construction sites have there been cases recorded at?
So it's a new case. So it's an individual who's not linked to the other cases in Mitchellshire. As I said, there's 11 active cases in Mitchellshire across about 3 separate, very small clusters. Again, not many exposure sites, not much movement, but obviously, we don't want to see any of them, so they're all areas for concern. Look, and I think there's a question that was asked yesterday. There've been a number of different examples of construction workers from regional Victoria. I think Simon, you asked it, from regional Victoria, acquiring the infection, we think, within their work sites in Melbourne and vice versa. So we have at least one example in Melbourne, in Ballarat, of a construction worker who lives there, working on sites in Melbourne and taking that infection back into the Ballarat community with them. We've got at least 2 examples of something similar in Geelong-based construction workers working on sites in the city, and we've got at least 2 examples in Mitchellshire of construction workers living in Mitchellshire, including the one I've mentioned today, working back in the city. And there are others, but those are the ones that are immediately top of mind. We've also got examples of construction workers residing in Melbourne, working in regional locations, and again exposure. So we had the exposure sites in Ballarat from 10 days ago, construction worker from Melbourne who was doing some work in the Ballarat area. So we're seeing it in both directions. That's why that further control has been put in place a few days ago to say we do not want to see construction workers crossing the border. And I appreciate that's inconvenient. I appreciate that's another constraint, but yeah, we're all doing all we can to do really 2 things. One is to minimise particularly seeding of further infections into regional Victoria. We want to maintain those levels of greater easing that we're seeing there now, and we want to enable as much of the construction industry to continue as safely as it possibly can, which is why we're accelerating that vaccination program, accelerating our focus around enforcement on sites and making sure the construction industry, which does a really good job on the whole of maintaining its standards, is doing everything it possibly can to minimise onward infection.
Right, they're currently protesting. Some of the construction workers are actually sitting out and blocking city streets at the moment, protesting the fact that they can't have lunch or smoko together in their tea rooms.
Yeah. Look, I mean, I suppose I'd say 2 things. We've seen a number of examples, and I mentioned the other day, and I appreciate people think it's an amusing issue, but when you've got people who are coming from across the city working in the construction industry, and they're sitting in small cabins and in small huts, enjoying food and drink together, that is a significant risk of transmission. The Cho's talked about it many times. I think it's a fairly self-evident risk that we need to manage. The weather's getting better. It doesn't seem to be unreasonable to partake of those activities outside, preferably not on the tram tracks. I think I'd appeal to the industry and to the employees. So many sectors, so many employees would love to be at work. So many of us would love to be working almost normally. And actually people are bending over backwards to keep the construction industry going and to keep those important sites going for very important reasons. So please don't, I think we all need to be a little bit humble on this and recognise the privileges that those of us who are still able to work get. And if it means you can't sit next to your mates while you're having a sandwich, that doesn't seem to be a huge burden to bear.
So why not
Will
shut
any
down
of
the
them be
industry like
fined?
New South Wales
Well, for I think, again, not an issue for me, it's an issue for the Chief Health Officer, but that's something we don't, we want to avoid. We want to avoid as much as possible putting those kind of measures in place. But if we're in a world where we're seeing significant seeding of transmission and significant seeding of cases, then that'll be an issue that Cho has to review.
What about the freight industry? So this is,
Yeah.
we've had numerous outbreaks occur and it's happening in essential worker settings, beeline, construction, freight. What are we doing to mandate this setting? Can we have more regular testing, mandatory vaccines?
Yeah, as I've said, so there is a requirement for freight workers, interstate freight workers, to have that first dose vaccination. So that that work is going on, and all the states are aligned on this. We all want to get that industry as vaccinated as quickly as we possibly can. Secondly, we've put a huge amount of resources into additional vaccination facilities for the freight industry and testing stations, so that those drivers can undertake their regular testing regime. I think it was back in the middle of June we started to ratchet up the requirements on the interstate trucking workers to ensure that they get tested every 3 days, and there is a significant enforcement effort being undertaken by Victoria Police and our authorised officers on those key truck routes to ensure that drivers are complying with that.
Can I ask, is it being policed efficiently, do you think?
Oh, look, I think there's 300 or so police officers involved in protecting that northern border, and we're seeing with the four positive truck drivers I've reported on this morning who've been through that corridor, highlights a very clear and present danger that it represents on an everyday basis. That's why we put the border bubble in place. That's why we have those border controls. That's why VicPol have got 300 hard-working members up there doing what they can to ensure the industry maintains its standards.
Jerome, just on the border, will Wodonga residents have to follow stay-at-home orders if they've been to Albury?
No, so I think Wodonga residents are under the existing controls around the border bubble. So again, there's a limited number of reasons by which they can go across the Murray into Albury. That's a significant challenge, I think, for that border community, given how entwined those two towns are. But I think those restrictions were put in place a number of weeks ago. Those restrictions maintained. It's very important people continue to operate in line with those restrictions and monitor very closely for symptoms. We've got no evidence at this point in time of any transmission back into Wodonga. But again, I think we have a number of locations in regional Victoria that we're watching very, very closely. We're watching it closely with our local health services and local partners. We do not want to see uncontrolled spread into those regional towns when they're on a lower set of settings.
Geelong has got 13 active cases, more than Ballarat. Why isn't Geelong in lockdown?
Well, I think we talked about it yesterday and the day before. The issue for us with Geelong is that we've got we have clearly identified sources of acquisition. I recognise a bit of work to do on one of the cases in today's numbers, and we'll be very interested to see where that transmission came from. We understand the downstream impacts. The primary close contacts are well defined. They're all isolating. We don't have any wastewater pinging in places we don't expect it to be pinging in the Geelong area. So at this point in time, that feels like a risk we can just about manage. Now, clearly, if we're seeing multiple cases springing up day after day after day, then the Chief Health Officer will have to review that very closely.
And it's the same for Mitchell Shire, no wastewater there?
Exactly. No unexpected wastewater detections in Mitchell Shire. Again, we understand the positive cases. We're seeing good testing numbers. People are coming through. If you go back to Ballarat, what worried us significantly in Ballarat 2 or 3 days ago was a number of different wastewater catchments all activating at the same time. A new unlinked positive case coming forward who'd been infectious in the community for over 10 days and with a large number of exposure sites around them. That's what caused us concerns around Ballarat. If the results for Ballarat in the last 24 hours are, I would say, encouraging, because it's, again, within their primary close contacts. All that contact tracing process are working quite well. Great testing results. Let's see where we are in the next few days, and that will give us more confidence. And as we said, our desire would be we don't find any more cases, and we can run this one out very quickly.
What about the rest of regional Victoria? Any other areas on high alert, in your opinion?
No, I mean, obviously the ones I've gone through this morning. So the ones we're watching most closely at this point in time, Mitchell Shire, Geelong and Wodonga. Wodonga more because of the Albury connection and that ongoing freight exposure. So those would be the three that we've got our eyes on most closely right now.
The lockdown, would you say, or just how?
I wouldn't say that at all, no.
Okay.
Just on the border, for those who have been on the border for 3 weeks, they're fully vaccinated, had a couple of negative tests.
Yep.
So they've had a permit to cross, but then that was revoked, say, when Bendigo was removed from the border.
Yeah.
Why can't they travel an hour and a half or a quarter to return home? What's the risk to the community there?
So I think two separate things going on. So I assume you're talking about Victorians who are on the New South Wales side of the border bubble and trying to get back into Victoria. So there are around, I think we've had just under 300 applications from Victorians in that predicament. So people who are encamped on the New South Wales side of the border in the border bubble. We've been in contact and close dialogue with all 300 or so. We're just under 300. A number of them have come back into Victoria under those vaccination, negative testing, and being able to evidence they've been in the border bubble for at least 2 weeks, and they've come back into the state, and they're under a home quarantine protocol that we've developed with them, and they'll be supported to isolate at home for those 2 weeks. We will continue to support the remainder to make that similar journey across, but they do need to evidence their negative test results and their vaccination status. I don't think it's tied into Bendigo coming out of the border bubble, but happy to have a follow-on on that.
Construction again. The government's been doing these compliance checks at work sites as part of this blitz a couple of weeks ago. Do you have any info on how many checks have been done, what's been found, any infringement notices?
Not today. So I think we'll provide an update on that, I think probably tomorrow, in terms of, I know it's a huge effort that's been going on over the last few days around supporting the construction industry to do the right thing, and a lot of inspections on different construction sites. I know the teams are out there again today, and they'll be out there all over the weekend. And we'll provide an update on the numbers over the weekend.
Have there been any cases at level crossing removal sites?
Not recently, no. I think we had the case down at Edithvale a couple of weeks ago. That's the last one I can recall.
Will any of the tradies that were protesting today, will they be fined?
Don't know. If there's an authorised officer in the vicinity, they may choose to go and do so. I haven't seen the protest. I've been focused on slightly more important matters.
Picnics are back tomorrow, obviously for the double vax primarily.
Yeah.
But how concerned are you about what that might mean for transmission and cases going forward in the next few weeks?
Oh, providing they don't picnic on tram tracks in the city, I think we'll be okay. Look, I think this is something that the Premier went to yesterday, and I'm sure the Chief Health Officer will discuss when he's next out. The restrictions were eased for a reason. It's a carefully balanced package. It's not as much easing as I'm sure any of us would want, but it's a small step to give people some of those important freedoms back in. That's been managed. Obviously, we will continue to encourage people to do so responsibly. It's not, look, yes, of course, it's about the detail of the restrictions. It's also about the spirit of the restrictions. So, yes, we're saying it's okay for 5 people fully vaccinated, 2 households and dependents to come together and to enjoy a picnic. Let's not abuse it. The questions we had yesterday around, well, what are the fine details of picnic versus playground versus vaccination versus drinks and coffee and masks? There'll be a detailed answer to that question, but there's also a spirit. If we're seeing large groups of people all hanging out together without masks on, holding coffee cups, that's not what we're all trying to achieve. We're all trying to achieve is to reduce the numbers of infections in our community so we can get rid of this damn thing, get ourselves vaccinated, and have greater freedoms ahead.
Do you have a little bit more clarity on that though? Obviously you've got playgrounds and parks are sort of one in the same sometimes. So people need to know if you're in your group of 5 fully vaccinated, but still only one parent or guardian can go over to push your kid on the swing. So I know it sounds stupid, but people need a little bit more clarity.
I don't have that clarity with me today, but I think, again, I'm happy to get the Cho to provide some updates on that.
Can we ask Mr. Foley about...
Yes, Mr. Foley.
Minister, what's your thoughts on cutting the Pfizer gap to 3 weeks? If we get to 80% first doses, is there capacity then to bring that forward and potentially fast track the rollout?
So as Jerome indicated, and that's based on public health assessments, there's better benefit to get more people vaccinated quicker with first doses for that ring of protection that it brings. And that's why within the ATAGI guidelines, the Pfizer dosage was pushed from 3 to 6 weeks. At the moment, if that were to be brought back to 3 weeks, we would be over 300,000 vaccines short of Pfizer. So we wouldn't want to be counselling other people's first vaccines for Pfizer for bringing forward second doses for some 318,000. If we were to get 318,000 more week on week, then that would be something that we could address. But it's all about supply and increasing demand. We had a record day yesterday. We've had a record week. Victorians want to get vaccinated, and they want to get to 70 double dose. They want to get to 80 double dose as quickly as they can. And I understand that part of getting to 70 and 80 is linked to that. But equally, to get to your second dose, you have to have your first dose. And what we need is more Victorians to come forward. We need more GPs, and they're coming online. More pharmacists, they start with Moderna next week, and we need more supply.
Minister, when you're expecting an update from the federal government on that supply? Is that today at the National Council?
I would imagine so, and there's health ministers meeting shortly that will also go to these issues. But Lieutenant General Fruin and his Horizons documents process has been pretty good. And if that can provide more vaccines for Victoria to get us to 70 and 80 quicker, then that's something that I think we'd all welcome.
Minister, research by the AMA and the Nursing Federation, a few other peak medical groups, are very anxious about the opening up plan. They say we need to prioritise people's health and well-being above getting on the beers.
Yes.
Are we going to open up too quickly?
So I've been talking with all of those organisations regularly, including in the last few days, and they've shared their concerns very forcefully. These are people who for 20 months now have been at the front line of our public health response and know from last winter just what outbreaks can mean with over 800 deaths in Victoria, and particularly from our private residential aged care facilities being overrun and those patients coming into our public health system. These people, whether they're AMBOs, whether they're salaried officers, whether they're nurses, clinicians, the entire public health workforce have been working like never before in a system that has been busy like never before. And they've expressed, quite rightly I think, their concerns about what would happen if we had continued high levels of uncontrolled infections in our community. We're working with them and we're working with our health services to make sure that we have plans in place to try to avoid that. But the best thing we can all do is, as Victorians, is to make sure that we follow the public health rules, that we get tested and that we get vaccinated. That's how that scenario gets avoided. In the likelihood that there will be continued increases in infections, we are working with the health services and all of those groups to put in place the best way in which we can manage those increased demands.
Do Victorians have to be prepared though? If case numbers are going to go up, we're going to see more Victorians die if we open up.
The current projections continue to see the case numbers go up, and as we see case numbers go up, we see more Victorians treated in the community through the COVID positive pathway arrangements at home. We see more people admitted to hospital, and we see, sadly, a small number continue to die, like we had, tragically, another death to report this morning. That is the reality of the COVID outbreaks. And the best thing we can all do is, if those numbers increase, is get ahead of that increase by following the rules, getting tested and getting vaccinated. They are the best things we can all do to assist our frontline healthcare workers to both make their job easier. They have been working like never before in the last 20 months. And it's the best thing we can do to make sure our health system comes out the other side of this in the best possible position.
How do you balance the competing or the interests of, a health system clearly under a lot of pressure with, say, business groups who want to open up hospitality?
Carefully, and through bringing people along through shared plans of where we want to go. A careful, measured process that the government will set out on the weekend will take into account, first and foremost, the safety and the well-being of Victorians as we get on top of this outbreak through the processes, particularly of vaccinations, and then as that occurs, return us step by step, measure by measured processes to get us through this really troubling wave that we're dealing with.
Minister, research by... They won't have the workforce capacity when hospitalisations peak. What's being done to ensure that we do have enough healthcare workers?
So we've invested over the last 7 or 8 years record amounts in bringing on more AMBOs, more nurses, more clinicians, better facilities, new hospitals, new community health centres, new supports in the community. Our health workforce has had an investment in it like never before, but equally, the demands on that health workforce have been like never before. Our health workers have been absolute champions for all Victorians over the last 20 months and are fatigued and are tired and nonetheless know that there are huge challenges coming for them over the next couple of weeks, if not month ahead, as we would expect this current trajectory of infections to continue to rise, which will see more people needed to be treated in the community and in our hospital system. And we are confident that we've got in place the systems to manage that, but the best thing we can all do is to manage that, is to keep those infection rates as low as possible. And I'll say it again, get tested, get vaccinated, and help our health system come out in one piece on the other side.
Minister, the research by the Murdoch Children's Research Institute found that COVID symptoms in children rarely persist beyond 12 weeks and that Delta for children is no more severe than previous strains. Is this reassuring, and does that give any confidence for your roadmap in getting those kids back to school?
So I know we've got a few kids in ICU at the moment. We've got a baby in ICU. So it's not as if it doesn't happen. We value and we work extremely closely with the Murdoch Children's Institute and others. But what we've seen, whether it is in childcare centres, in those schools that have been continued to be opened for essential and permitted workers, we've seen a large number of those cases in young kids. It's not as if it doesn't happen. I'm reassured that it's not as dreadful a infection as it is for older people, but it still happens, and it's equally the case, not so much about, yes, it's an issue for transmission amongst kids, but kids go home. Kids are part of families, and we've seen that transmission kick off the north and the western clusters in such a way that you can link it back to a number of key childcare and other centres. So we truly welcome the intelligence and the material that the Murdoch Children's Institute provides us, and it's no doubt accurate, but it's then how does that amplify across the rest of the community.
Do you have the age of that infant in ICU? Sorry.
beg pardon?
Do you have the exact age of the infant in ICU?
I know it to be a child under 1.
Are there any other underlying health conditions?
I don't know, Rachel.
Mr Foley, New South Wales has just announced they're going to start trialling at the end of the month a 7-day quarantine for returned overseas travellers. Thoughts?
Oh, well, I haven't been briefed on that. I know that there's lots of discussions going on through AHPPC, through the Health Ministers Forum, and through National Cabinet about what does safe, steady steps look to bring us back to being engaged with each other in our own community, with each other across Australia, and with each other across the world. And again, those safe, measured steps are what we're all aspiring to. And the best thing we can do to get there is to get vaccinated as soon as possible. Because my guess would be that the increasing focus will be that those arrangements will apply to people who are fully vaccinated, because they are lower risk, and whether it's able to travel internationally or to be quarantining at home under less strict arrangements, I'm pretty sure that New South Wales, Victoria and any other state would only contemplate that for fully vaccinated people.
Is our roadmap on Sunday likely to include any provisions for overseas return travellers?
We'll wait and see what comes on Sunday.
Minister, what is the patient load expected for the next week or two, and just how much pressure will hospitals come under?
So we've seen a steady increase. I think we indicated that the number of people in hospital at the moment was, I did indicate what that figure was. 208 people currently in hospital. We've seen a steady increase in that. Our hospitals are based in their COVID response through a series of streaming hospitals, where specialist areas, the Northern, the Alfred, the Royal Melbourne, and then we have specialist for particular demographics, the Royal Children's, the Royal Women's, and Monash for expectant mothers. And then we have lower acuity areas for older Victorians, for hospital care in Epping and Bundoora. They're all being scaled up and continue to be. In addition to that, we're making preparations as we speak for other locations around metropolitan Melbourne and regional Victoria in the expectation that those numbers will increase.
What's the current ICU capacity?
Well, we have, in terms of people in ICU with COVID at the moment, I think I did indicate that figure. We have 49 people in ICU who are COVID positive. As you'll recall, at any time we have somewhere between 430 and 550 at the moment ICU facility beds. We've got the capacity through investments that have been made over the last few years to ramp that up through over 4,000 ventilators, and as each of these necessary measures to bring further hospitals online, those components of ward beds, ICU beds and treatment in the community supports are all factored in to our COVID positive pathway plan.
If both case numbers and vaccination numbers in Victoria and New South Wales are high, when is it time to start considering free travel between the states again? And will that broader question of borders and travel be addressed in the roadmap?
Well, when Victorians and New South Wales people are all vaccinated at the highest possible level to make that safe, and there are as few as possible active cases in the community. Those will be judgments that each state and territory's public health officials will make. That's the goal.
Just on that, given we've now got more than 500 cases a day in Victoria, do you believe that people returning home from New South Wales, some of whom are fully vaccinated, who've had a test to quarantine at home, actually pose more risk to the Victorian community than any other member of the community who's out and about?
Well,
and if they don't, why can't these people return home now?
So it's not so much a question of what I believe, Rachel. It's what does the public health evidence and the relative risk management assessments make. We have in place a system now, and to encourage those people in the border bubble who've been there for a period of time to get back home as quickly as possible. We're always looking at what further assessments can be made as the relative risk between jurisdictions gets measured, and as that risk has changed over the course of the last 20 months, particularly the course of 2021, the public health team have changed their assessments and arrangements, always with a view about what's the best thing to keep Victorians safe. So as the evidence changes, the public health response changes.
So can we expect a change on Sunday?
The Sunday discussion, as I understand it, is all around the roadmap. These other changes are made on the basis of literally day-to-day, hour-to-hour assessments. So we'll just have to wait.
In terms of Sunday, given that you are talking very closely with peak medical groups about their concerns, do Victorians more generally need to, I guess, temper their expectations as to what's coming on Sunday?
So, as the Premier indicated, the key markers in Sunday's plan are making sure that the Victorian application of the national plan, the 70 and 80 double dose arrangements, are the key feature. And the careful, safe, measured steps that surround that, you'll just have to wait till Sunday, but we're confident that it will strike that balance. But at the heart of it will be the safety and the wellbeing of Victorians, and at the heart of that is the continued operation safely and effectively of our health system.
Just on that, so New South Wales has obviously lifted their curfew. Ours remains in place, and Sydney has just announced their first major event in the wake of the lockdown. They'll have 5,000 attending an event on October the 16th. So can you give us any indication of when we can start to see these kind of freedoms in Victoria, given that we don't have the caseloads of New South Wales?
Sunday is not too far away.
Sorry, I know we asked Jerome, but do you have any more clarity on these park rules and what people can actually do in terms of removing masks to drink and eat tomorrow?
Yeah, as Jerome indicated, it's applying common sense. Those original rules, you'll recall the infamous pub crawl and other arrangements that were put in place And it's still there now about making sure that once you get your takeaway, whatever it is, move away before you consume it. That's the plan. And of course, if there's need for enforcement, it won't be enforced on people in groups of 5 from fully vaccinated households of 2 households with their dependents. But of course, if there's a spontaneous group of 30, 40, 50, then of course that's going to be enforced. Victorians have worked so hard to get us to this impressive 70% first dose figure, and these careful, measured moves are all about a small recognition and reward with more to come. No one wants to abuse that. You're not going to have authorised officers in Victoria Police tapping you on the shoulder at every group of 5. This is about people exercising common sense and doing the right thing.
Can I just
We've got to go.
Can I just clarify on construction workers? Obviously, metro tradies can't go to regional, but can metro tradies travel anywhere within metropolitan Melbourne, or are they subjected to that 10-kilometre limit? Because I don't believe Dan mentioned it.
If you're an authorised worker, we released data, I think, I forget who it was, earlier this week, released data about just how mobile our construction sector is. It's the most mobile of all the permitted workers. And that's fantastic, but with it comes responsibilities. And we've seen the figures we released earlier this week, some 13% of cases statewide had come from the construction industry sites. By the time you then amplified that through social and family and community settings, it was running at about 1/3. So there are issues and they have to be dealt with. And I'm really pleased that the construction sector has stepped up to deal with those issues. But if you're going to stay open, you've got to stay safe, not just for your workplace, but for the community that you're a part of and the health systems that your infected cases invariably end up in.
That doesn't answer the question. So, for example, can a
Yes,
worker based in Pakenham travel to the western suburbs?
If that's their permitted authorised
site.
site.
It says in the show guidelines here that
You can't cross the metro border.
It says here in the show guidelines that they're subjected to the 10-kilometre limit.
If you're a permitted worker, you can travel to your permitted workplace. We're happy to clarify that, but that's what's been the case for not just construction, but all permitted workers have been able to visit their permitted workplace for the purposes of work. What the change now for the construction sector is you can't cross that regional-rural divide, particularly given the number of cases that have seeded from metropolitan Melbourne, not deliberately, but just this is what happens in cases like tea rooms, for instance, into regional Victoria.
Do you know if that child in ICU is on a ventilator or
No,
not?
I don't. All good?
Do we know how many people in Hume are currently isolating?
A big pardon?
Do we know how many people in the Hume region are currently isolating?
It will be home isolated was the question. It'll be the vast majority. I don't have an actual figure, but I'm sure we can get that to you. In terms of positive cases, the scenario runs most people safely and carefully home isolate. A number of those start their COVID positive pathway with primary and other healthcare support for them, and then smaller numbers in hospital, and then smaller numbers again in ICU. But as the caseload grows, the proportion of each of those various measures grow. And the best thing we can all do on closing is to make sure that that doesn't happen, is follow the public health rules to protect us all, get tested as soon as you possibly can, and get, if you show any symptoms at all, and get your vaccination as soon as you are able to. Thanks everyone.